Hello, how are you doing? Okay, let's talk about career path of paramedical courses. And the scenario I would like to discuss, or a question that comes to most of the students is, are say I am a 10 plus 2 student in biomath. I belong to an ordinary family. What I need is a job. Okay, I'm not interested in engineering or MBBS. Well, what is suggested in that case is do a degree in paramedical course. Paramedical means you're someone next to the doctor. You will go attend emergency calls, and you are the first one spending the initial golden hours, and your job is to start the recovery, avoid worsening conditions until you reach that hospital and until the doctor joins you. Okay, that's what paramedical course means, or a professional means. Make sure in your 10 plus 2 you got to study physics, chemistry, biology, and English to apply for paramedical course. And even though you couldn't do MBBS, being being the fact that you like biology, you still part of the medical industry, practicing paramedical um, profession. Uh, Fortunately, this degree courses finish in 3 years, and your cost is also comparatively low. Paramedical, maybe we can divide into three major areas. Medical emergency, where you are a critical member of a ambulance emergency call, and you arrive at the scene of emergency, provide life support to the injured or the critically ill person. Okay, and the golden hours you make use of it so that his life is recovered sooner than later. In the paramedical course of in the short-term certification courses where you focus mostly on first aid procedures. You are taught how to preserve a life and avoiding the worsening of condition, and how to promote recovery, and how to handle the patient properly. Okay, and they teach you all these important things being a first aid paramedic professional. Okay, in case of diagnostics, being a paramedic professional, you work and focus on medical lab and radiology. Courses types, well, there is diploma course, to 6 months to 2 years, and there is diploma. I'm sorry, the first one is certificate, then is diploma course, which can run up to 3 years, and you can start diploma after a 10th. Then there is graduation after 10 plus 2, and there is post graduation after graduation. Being a Yeah, you are also eligible to write any PSC exams, civil service exams. Okay, now let's take a closer look at what are the major degree courses under paramedical. Now I grouped them into one, two, three based on the industry demand, salary, and higher studies options. Okay. Group 1, degree in pharmacy. Now, please make a note that this is the only course where you need to write a joint entrance test, typically run by each state. Okay, and all other paramedical courses that we discuss here in group 1 to 3 does not ask for any entrance test. All they look for is your 10 plus 2 credentials. Um, Look at the cutoff marks here for the B farm. Okay, be aware of it. Um, okay. Then group 1 BSc nursing. This is an obvious one. Everyone knows about nursing. Then group 1 degree in lab technology. This is also very common. You will be part of the laboratory test, um, body fluids, tissues and blood. Group 1 degree in radiology. We are all familiar with X-rays, ultrasound, CT scan and MRI. So you get properly trained here so that you can assist in getting this thing done for the patient. Job openings are great. You can easily find jobs 8 out of 10. Higher studies, you got more options also. And let's move on to group 2, degree in cardiovascular technology. Well, you will work in cardiac cath lab. Okay, those are complex operations, or procedures where you get involved in stent, implants, pacemakers, defibrillators, etc. Your job is to diagnose heart disease and aid the doctor to reach conclusions. Okay, you will also be asked to be part of emergency calls, both in the hospital as well as in the ambulance if needed. Um, these are life-saving skills. Okay, you will need to also understand ultrasounds reports to some extent, so that you can help the doctor to speed up the process of diagnosis and to understand where is the exact problem. Is it vascular, artery, or valve, or vein, things like that. So it's interesting, very interesting. You are very valuable being a cardiovascular technologist. Now, perfusion technology in group 2, degree in perfusion technology. Well, in a cardiac surgery, hospitals use machines like external heart machines and cardiopulmonary bypass machines. You know that when they do um, when they do cardiac surgery, they have to stop the heart to some extent, and external machines come in to take care of the patient's physiological status. Okay, and you study all these important topics, and you assist the doctor to operate these machines so that the surgery goes smooth. This is an important field. Now, optometry, degree in optometry. This is very familiar, just like lab um, technology. Optometry is also very familiar to us. This focusing on vision, and you are allowed to do all these practices. Okay, once you are licensed. Dialysis, again a common area. Um, the patients having renal failure, which is kidney, you will be doing dialysis for those patients. Okay, there are machines, you operate them and also monitor them. Rehabilitation medicine, this one is for those persons who are disabled due to a injury or critical illness or any disorder. So your job is to bring back the quality of life as well as make the patient independently do his daily needs. Okay, so that's what it is when we say rehabilitation. Okay, so the person can live with dignity independently and enjoy the life. Okay, now anesthesia is very known to all of us. So you basically do administration of anesthesia as well as monitoring the patient. Thereby you assist the doctor, okay, to do whatever needed. You get extensive knowledge also on all these areas, and these are your strength, personal strength. Make sure you perform well personally also. Your openings are 7 out of 10. You have higher studies but are limited. Group 3, degree in audiology, speech therapy. Um, these days, speech therapy is very common and known to us since last 10 years or 5 years. There are a lot of requirements. They are called audiologist or speech therapist. You study hearing, speech, and balance related disorders. Your employers are medical hospitals, various clinics. In the hospital will refer the patients to uh, SLT, speech language therapist. They are also employed in cochlear implant industries. You are very much needed in special schools because of these many problems. Okay, and you are also required in the hospital to assist the patients who undergone serious injuries, stroke, and brain injuries. Okay, at some point you can also start your own practice. Okay, physiotherapy, group 3, degree in physiotherapy. Um, what if you undergone a serious physical injury, a major surgery, or illness, critical illness, or a disability? Then what happens is you have severe pain. Your mobility of your organs or limbs or hands or whatever are restricted. And sometimes you lose strength of your muscle. Okay, so that's where a physiotherapist comes into play and become invaluable, where he relieves your pain, he improves your mobility, strength of your muscle, etc. So you are back on feet, and you can move your body. Okay, there are also patients who need physiotherapists who got all these posture problems. Okay, and there are basically three types where people focus on: sports physiotherapy, and physiotherapy in rehabilitation, pain management, and physiotherapy in musculoskeletal also. Now let's move on to occupation therapy. Um, they focus on daily living skills and work life. Okay. Now you know that you can be severely affected due to physical or mental, developmental or emotional situations. Okay. Then if your daily living skills are stuck or you can't work due to all these situations, then that's where OT comes into play. So they help you develop, recover, etc., so that you can do your daily living skills and also work and also go for work. Okay, your work life as well as your normal daily life are enhanced significantly so that you enjoy the quality of life. Just want to quote you one example what it meant by uh, the need of a occupational therapy. What if you lose your mobility in hand or fingers? Okay, and that's where OT also comes into picture, and this is how they help to um, improve significantly on your uh, hand or fingers, loss of mobility. Now, if you see that PT, which is physiotherapy, and OT, are very close, and it may create you some confusion. But here is a major difference between them. A PT focus on improving significantly your ability to move your body. Okay, whereas an OT is focusing more on once you are able to move your body, then they are helping you to make sure that you can do your daily living needs as well as you're back on your work life. Okay. Now the group 3 job openings are 6 out of 10. You can have a practice career also. Once you have significant work experience and what you call, you build references, prove your skill, etc., customer base, then you are ready to go for your own clinic. Your higher studies are limited though. Now, having familiarized with all these courses, what about the top institutions in the country? Well, when you pick up an institution, whether it is local government or top institutions, make sure that these institutions practice a lot of numerous specialities. There is wide range of modern equipments and 300 plus beds. Okay, and they follow quality standards like NABH and IPHS, so that your effort of studying there also get great recognition, and maybe they themselves will absorb you as an employee. Now, if you look at both government and private institutions, these are countries' prestigious institutions which you should try to get in there, and there are private players also. Okay, so I encourage you to spend some time to learn about these institutions, what their achievements, how difficult it is to get in there, and all that cut-off marks, things like that. Please do some self-research. And when you come to salary, um, from BSc nurse all the way to BSc occupational therapist, you will see here a starting range as well as a salary of an experienced professional at this time. Okay, so I encourage you to spend some time in this part of the video to go over it and get an idea of to decide what you want to do for your paramedic course, which one to choose from. um, Please read the disclaimer, and on a final note, I hope my sincere effort was some help to you. I thank you for listening, and all the best to your career journey. Bye for now. You take care.